Hi, my name is Natalie, and my main proposition is that physician-assisted suicide is a good alternative for terminally ill patients. And what that means is that it's like basically doctors help terminally ill patients to commit suicide by prescribing them medicine. And I will prove this to you with my three main premises, which is the assisted suicide. It helps patients by ending their suffering. It can reduce the cost for health care, and it can help other patients that are not terminally ill. My first premise is that it'll help patients end their suffering because, what person wants to go through side effects like vomiting every single time, weight fluctuation. And so Robert Perlman, which is a professor in the University of Washington, and Helene Starks, which is an assistant professor, had interviewed 35 families to question why they would want to seek physician-assisted suicide. And they had come to the realization that it's not just one reason why they want to die. It's like three main reasons, or it's like 9 common factors, which is like they don't want to feel weak, tired, and uncomfortable. They don't want to lose function. They don't want to accept side effects from the pain medication. They don't want to lose their selves as time goes on. They want control. They want a fast death because they'd rather have that than a painful, long-lasting death. So then they also have fears about the future and what their life is going to be if they stay and live longer. They probably had negative past experiences, and they don't want to feel burdens to their families. This being said, though, in order for them to do that, they should have their right to die, because there's only 4 states in the U.S. that actually legalize assisted suicides, those being Washington, Oregon, Vermont, and Montana. And it ends up being that the Supreme Court actually ruled the Montana case between a patient named Baxter and the Montana government, and it ends up being that the Supreme Court says that that it's not they can terminate their own life because it's in their constitutional right. The Supreme Court has also ruled in a 6-3 ruling to support the Death with Dignity Act in Oregon, which people were trying to repeal in Oregon. My second premise is that they want to reduce the cost. Assisted suicide can reduce the cost for health care, which would basically mean people who are terminally ill have to face not only insurance bills, but mortgage bills, car bills, medical bills, stuff that the insurance company is not going to pay for. And some people probably don't have the money or can't rely on other family or whatever. So it's not just for the patient that it gets expensive for. It also gets expensive for the hospitals because they have to constantly order tests and order labs to see how far is their disease spreading and how long is it going to take, that kind of thing. And then my third premise is that assisted suicide can help save other patients if they're not terminal by organ donation. And to be an organ transplant, you have to, in some cases, to donate organs like kidneys and hearts, the person obviously has to be dead, which is why other people can't donate them unless they're in a car accident or whatever. But even then, you have to be willing to donate, and otherwise their organs are going to be trashed. That being said, organ cancer patients, they can try and donate, but with the risk for that is that they still have cancer cells, so that if they get a transplant, if they donate their organs or whatever, there's a possibility that the recipient can get those cancer cells, or that yeah, the cancer cells. And then it's better for doctors and nurses to kind of like spend more time on the people that that are more urgent, like and that have a more higher chance of living than terminally ill patients, which is why I feel that physician-assisted suicide is a good alternative for terminally ill patients. Thank you.
All right, the proposition when it's presented as a value claim, you say it was a good alternative, which makes a valuative judgment. I think if you made the argument that says it's a necessary alternative, it would be an effective alternative, it would eliminate a particular kind of problem, that would be a clearer way that it would fit into the claim of fact criteria that we're talking about. You do signpost what the secondary points are going to be, so that's pretty clear. And in the body of the speech, you're also trying to signpost as you go along, although it did feel sometimes like those points were a little bit underdeveloped. So you spent a lot of time on the first point, for instance, and I think you actually had a couple of points on that first point, not just the argument about why people need to have access to physician-assisted suicide, but then you also had an argument about its legality and constitutionality in that particular point. That might have been its own separate point, although I'm not sure that that really focuses on the controversy that you're talking about, which is whether or not it's needed. Whether or not it's legal or constitutional is not relevant to whether or not it's something that would effectively reduce people's pain and suffering or prevent a problem from occurring or saving us costs. The second issue that you present on costs is really dependent on a couple of hypothetical examples. There's no data on this particular point, and I think it really raises a red flag for the person responding here who's likely to be looking at that and say, okay, so the decision about healthcare is now going to be made on the basis of what's cheapest and who's it cheapest for. You even mentioned that there are costs associated with the hospitals, so I can just imagine that this will be the recommendation that the hospital has instead of additional treatment, instead of pain modification. Here's, physician-assisted suicide as an option. That's one of the things that the people who are opposed to this are worried about, and you've just basically waved a red flag in front of that issue. I think that that's going to be problematic for you. I was completely confused on the transplant issue, whether or not you were saying that if we allowed people to die, they'd be able to donate their organs, or if we allowed people to die, then we wouldn't have to waste the organs on people who are terminally ill. And both of them, I think, are a little problematic, and both of them are really dependent on hypothetical information to make that particular point. You had good factual data on the states that are allowing it. I like the early information about the justifications that people who seek or are thinking about physician-assisted suicide would want. And I think that those points, for instance, could probably be developed a little bit more as the justification for the need in this situation. All right.